You may have asked yourself in the past or in the future when you're staring down the tower of sunscreens at the store when you're picking something out, is a chemical sunscreen bad for me? Let's talk about some of the choices and options that you have and help you make really good decisions when you are purchasing your skincare to protect yourself and your family. I am Dr. Lynn Neiman. I'm a board certified anesthesiologist, aesthetic medical provider at Blossom Medical in Northern Virginia. I am a doctor, but I am not your doctor. So if you have really specific concerns that relate to you or medical concerns that you have, I highly encourage you to talk with your provider. They would actually want you to do that. But hopefully I'm going to give you some information that's broad and that's going to help you make great choices. So the first thing that I want to talk about is light. Light is such a cool thing. And when we learn about the spectrum of light that's out there, that really informs some of the complicated decisions that we have to make about skincare. So in three broad categories, we're exposed to on a daily basis UV light, visible light, and infrared radiation. So that IR light, that's what gives us that sensation of warmth that we feel in the sunlight. Our visible light, obviously, it's right in the name, helps us see all the things in front of us. And then that UV light may not be something that we see, may not be something that we feel, but that definitely is affecting our skin. And it's affecting it in two broad categories. There's UVA and UVB rays that reach our skin. And UVA and UVB rays do something kind of different in terms of their response on our skin. So it's easy to remember it with this little mnemonic, if you will. So those A rays, and then we've got those B rays. So A, think aging, B, think burn, okay? So UVA rays are the ones that will contribute to our photo aging, and that is cumulative over time and exposure to UVA rays. The UVB rays are the ones that are going to cause that redness and cause a sunburn. Now, we've all walked in front of our just sea of choices for sun protection, and we've looked at that SPF level in the past. SPF stands for sun protection factor, and let's be really clear about what that means. The sun protection factor, let's say you're a person who could be out in the sun for 10 minutes without getting a sunburn. Whatever the sun protection factor is, we would multiply that by the time that you could have that sun exposure before experiencing some redness on your skin. So if you were on the sun for 10 minutes normally, and then you would start to see some redness, that SPF 30 would give you about 300 minutes before you would experience that same amount of burn. So typically, the American Academy of Dermatologists are going to recommend everyone be safely using somewhere between a 30 and a 50 SPF. An SPF of 15 will protect you from about 93% of the UVA and UVB radiation. An SPF of 30 will protect you from about 97%, and an SPF of 50 about 98%. Above 50 is actually pretty hard to study, and some clinical studies and sort of when they look at people's behavior tend to find that an SPF of above 50 maybe gives people a false sense of security where they think they've got this tremendous amount of SPF protection in, and they're less likely to reapply sunscreen later on because they think they have really high protection. So from a behavioral standpoint, we find that between 30 and 50 is that golden spot where you're going to get adequate and beautiful protection for your skin, but you're also going to remember to reapply your sunscreen every about 2 hours in order to keep yourself safe while you're out in the sun and having exposure to the sun's rays. SPF, measured in clinical science, is a measure of protection from UVB rays only. So we've said UVB rays burn, UVA rays aging, right? So we want to make sure that we find sunscreens that say things like broad spectrum, right? So broad spectrum means that we're going to have both UVA and UVB protection from the sun. So that's going to help us from those harmful burn rays, and those harmful burn rays tend to be associated with, as time goes on, that cumulative UV exposure, that carcinogenic effect of the sun especially for our squamous cell and basal cell carcinomas. Those UVA rays really increase our risk for melanomas. So you want to make sure that your sunscreen has broad spectrum protection. That's what's going to give you coverage for the UVA and UVB rays that you're exposed to while you're out in the sun. Now, let's talk a little bit more about ingredients, just so that you have some information when you go into the store and you're looking at different formulations. So typically we talk about sunscreens as either being a physical sunscreen or a chemical sunscreen. Physical sunscreens, believe it or not, those are referred to as inorganic, and our chemical sunscreens are actually referred to as our organic sunscreens. And that kind of maybe sounds a little counterintuitive to you, but the physical sunscreens are typically the ones that are using compounds like zinc oxide or oh my goodness, I just saw titanium dioxide. There we go. Those two ingredients to help to provide a barrier over the surface layer of the skin. Now, one of the misconceptions that people think is that our physical sunscreens will reflect all light. Now, they do reflect most of the light, but you still, even with those physical sunscreens, will get a little bit of absorption of that UVA and UVB radiation. It will undergo some chemical processes. You'll reflect the rest of that off, but it's not completely 100% reflective of UVA and UVB radiation. Some things to know are that the zinc oxide and titanium dioxide will sometimes create, in that product, they'll create a little bit of a white cast. And as we've learned how to make those particles smaller, making nanoparticles, they will reflect less of that white color. And so those formulations have really come a long way so that they're easier to rub into the skin and so that you don't end up with that whitish cast from that physical sunscreen. A lot of times, if you're a person with very sensitive skin, having that physical sunscreen will actually be a really good product for you because there's less likelihood that you might react with some of the chemicals that are in that sunscreen. So if you're a person with just very sensitive skin or sensitive prone skin, you might do better with a physical sunscreen. So that physical sunscreen, inorganic sunscreen, has those two ingredients that you want to look for, titanium dioxide and zinc oxide, and those are going to provide you with that UVA and UVB protection. One thing that I did want to mention to you is that titanium dioxide has a really broad range of wavelengths that it protects you from, but that zinc oxide actually gives you a little bump and a little better UVA protection. So if you're someone who's looking at maybe a facial sunscreen and you like the idea of using a physical sunscreen, but you also want to get that kind of anti-aging effect of that effectiveness of that sunscreen by reducing the photo aging that you would get from UVA exposure, make sure that it also contains a good percentage of zinc oxide as well, because that gives you a more broad spectrum of that UVA protection in your sunscreen as well. Chemical sunscreens contain things like oxybenzone, avobenzone, octisalate, octocreolene, homosalate, and also octinoxate. I'm just going to say this for people who are traveling, and I'm going to double check my list because I always like to double check myself on this, but it's the oxybenzone and the octinoxate. Those two are the chemicals that we know have maybe some issues with environmental effects, especially in tropical locations and for coral reefs. So sometimes when you're traveling to a certain location, there is sunscreen that particular environment would prefer that you use and prefer that you avoid. Those two are the ingredients that, particularly in tropical locations that have maybe a barrier reef or something around them, if you're traveling to the Caribbean, you may want to choose a sunscreen that avoids those two chemicals. There is some discussion in medical literature about avobenzone and its potential for being a hormone disruptor. The critical point is when we look at chemicals and we look at the amount that's actually in a chemical sunscreen and the amount that we're actually exposed to in that chemical sunscreen, especially in the amounts that we're using, we have to think about the safety and the amounts that we're using. And so for that reason, I really think that chemical sunscreens are also a perfectly great, legitimate choice for you to make if that works for your skin. Some people who are Jarka Fitzpatrick types, or some people just really don't like the feel of that physical sunscreen and they prefer the feel of the chemical sunscreen. I think they're perfectly safe for you to use. I think our FDA does a great job of really making sure that those products are well tested. We know that they're going to give you the SPF protection. There's a really rigorous testing that goes into making sure that the claims with our SPF that are FDA approved actually achieve that amount of clinical protection for you in real life. And so sometimes if you order some things, I know it's there are a lot of things at Korean skincare that we can order, but sometimes those things actually aren't tested, and the SPF, so that sun protection factor that you may be getting, may actually be different than what you think you're getting based on what you're reading on the bottle. So just make sure that whatever you purchase, it has actually gone through testing to be sure that what you think your sun protection factor should be is actually what you are getting. If you are a person who has maybe an oilier skin tone, actually a chemical sunscreen might be better for you. And one that has kind of a serum or a gel-based formulation might actually be a really good choice for you. So the answer to the question, are chemical sunscreens safe? My answer is absolutely yes. The safest SPF, or the safest formulation for SPF, is the one that you are going to use every day on your skin, the one that you love the look, the texture, the feel of, and that you enjoy the process of wearing it. Those are going to be the sunscreens that you are going to reach for over and over again, and reaching for them over and over again is going to help them do their job, which is essentially protecting your skin, protecting you from those harmful UVA and UVB rays, reducing the amount of cumulative UV exposure that you have over your life, which we know reduces your risk of squamous cell carcinoma, basal cell carcinoma, melanoma, and then the other things like just the things like fine lines and wrinkles, sunspots, worsening of melasma, things like that that just happen with our repeated and cumulative exposure to UV radiation. So the biggest and the hardest part, I think, of SPF is finding the formulation that you like. If you are struggling, we are absolutely here for you. If you happen to be in the Northern Virginia area, you can reach out to us. There's a link below. We would love to see you in the office. We have so many things to show you and so many things for you to try on your hand, on your face, on your body, trying to find you the right formulation that's based on your specific skincare concerns and getting you something that matches up to the results that you want to see with broad spectrum protection for both those UVA and UVB rays. If you're not in the Northern Virginia area, we do offer online consultations, and we would be more than happy to hop on a little Zoom call with you. And we can go ahead and go over your skincare concerns, maybe the struggles that you've had with finding a good SPF in the past, maybe really talking through the hurdles that you have or the things that keep you from using an SPF on a daily basis, especially to protect those sun exposed areas, face, ears, neck, those things. We would be so actually thrilled and honored if you would allow us to help you choose a product that we think long term is going to help you look better, but also really be protective for you in terms of reducing your UV exposure and reducing your likelihood of having to manage a skin cancer later on in life. So please reach out to us and let us know any way that we can help you. And I hope that this gives you some information about safety and some information about just looking at labels when you're in the store. And again, we are always here for you. So reach out to us if you need anything. We'd be more than happy to answer your questions. Hope you have a great and beautiful day.